COVID-19 is now a pandemic spreading around the world. What exactly does that mean? What's this curve on the board behind me? And what does it mean when we talk about how we're going to flatten it? Those are all things we'll talk about in this episode of Shareable Science Behind the Blog. Welcome to Shareable Science. Science you can share. On the 11th of March, the World Health Organization declared that COVID-19 is a worldwide pandemic. Essentially, that means that the disease is now spreading in multiple places throughout the world. So you've got it in multiple different countries, all spreading at different rates. You've probably seen this curve a lot. I actually see this curve in my sleep right now. What does that mean? Let's talk through that. So this is the curve that models, and that's a really important word, this is a model of a pandemic. This is not the definite, but this is a model of the pandemic that looks at, on the y-axis, the number of new cases every day, and on the x-axis, the distance from since the first case. So days, weeks, months, higher number of cases each day, lower number of cases. Typically, when we think about pandemics, we start with a very small number of people. This is when the pandemic is easiest to control, when you can actually isolate, confine, and track everyone that's been infected. But if you can't control it at that point, then you now begin to have increasing number of individuals, and the doubling time of new cases begins to get shorter and shorter. So a doubling time of every 5 days, the number of new cases doubles, or every 2 days. So you reach this place where you are exponentially increasing your number of cases, and then you reach an inflection point where there are fewer and fewer new individuals being infected, and then it drops. And so now you reach the other end of the peak, and over here, you have fewer people that are being infected, in part because the virus has already infected most of the people that it's easily going to be able to affect. So you've got herd immunity. You've got more people that have been infected, and the data seems to suggest that at least in the short term, and maybe the long term, if you have COVID-19, you are resistant to being reinfected. There are some exceptions that we're still trying to track down, but you reach a point where fewer and fewer people haven't already been infected. The challenge with this curve, if you don't do anything, if you implement no mitigation practices, here is the problem. At some specific level, and I've just arbitrarily drawn this is the capacity of a country's or a region's healthcare system. This is how many cases in intensive care they can actively manage. This is how many ventilators they might have available. Or this is the number of healthcare workers that they actually have that could manage it. And you can see the problem with the way this graph is drawn is that from this time point, this window of time, you have more cases than you actually can manage, and you threaten to overwhelm or swamp your healthcare system. That's what we are beginning to see. That's what we are seeing in places like Italy, where they're having to make heartbreaking decisions because they've got more people affected than their system can handle. So that drives the concept called flattening the curve. And this is flattening the curve. Which is, can I slow the rate of new cases every day? Can I do things like social distancing? Can I find ways to reduce the number of new cases by making it harder for the virus to jump from one person to the next? Now, the challenge is, you can see it takes a longer period of time to actually implement before the number drops. So flattening the curve lengthens the amount of time that you're dealing with. And actually, the reality is that it probably looks something like this, where you're going to have cases as you begin to relax rules around social distancing and isolation, where you're going to have increases in cases, and then you're going to have to implement those steps again. So it's not a simple once and done. There are these bumps along the curve along the way. But the goal is if you can flatten the curve, then you can limit the window of time where you're overwhelming the healthcare system. And when you overwhelm the healthcare system, it's not just people with COVID-19 that run into problems. It's anybody that needs to go for emergency surgery or has a heart attack or has a stroke. If the hospital is overwhelmed with COVID cases, they're going to have a really hard time providing appropriate care to any non-COVID cases as well. That's why things like social distancing to try to slow the rate are so important. That's why the president's initiative, 15 days to slow the rate, is so important, to try to get to a point in early April where we'll know if we've flattened the curve or not. So I know you see this curve a lot. Hopefully this gives you a little bit more insight into how the curve is created and when we talk about flattening the curve, what that means and why that's so important. Stay safe, be careful. If you've got questions, please feel free to send them to AskDrLamb at HudsonAlpha.org, and we'll answer them in an upcoming session. Thanks, everybody. This is Science Worth Sharing. Please do share it with other folks. Be safe and take care.